Well, I have two different foci typically. So I look at vasomotor symptoms, the relationship to cardiovascular risk, and now today at this meeting I'll be speaking about sleep and the development of cardiovascular risk during the menopause transition. Well, this talk I'll be presenting on sleep and cardiovascular risk. So what we found was that women who had short sleep, who were sleeping less than 5 hours a night, had increased markers of carotid atherosclerosis relative to women who slept longer. We also found that women who had poor sleep quality, reported their sleep to be poor, had higher carotid atherosclerosis relative to women who had better sleep. Okay. So we measured all kinds of different cardiovascular risk factors, including blood pressure, insulin resistance, medications, obesity, apnea. None of these factors explained the associations between sleep and cardiovascular risk. And in my other line of work, where I look at the relationships between vasomotor symptoms and cardiovascular risk, I will say that these relationships between sleep and cardiovascular risk were not explained by vasomotor symptoms, but there was some evidence of a synergy. So if you had both overnight vasomotor symptoms and short sleep, you had the worst cardiovascular profile, although that was really just a hint. Well, I think there's a couple things. So one is to understand what explains the association between sleep and cardiovascular risk. This has been shown in large epidemiologic studies, but here we're showing it among menopausal women who are a group that really are at high risk for sleep problems. So something like 50% of women report problems with sleep. So we're looking at this higher risk time. This is also a time of increasing cardiovascular risk. So really understanding what role does sleep play in the development of cardiovascular risk over time? So really moving to the longitudinal context, that's one direction. The other is to understand the why, the mechanisms, which I don't think we've teased out yet well. And then the third is understanding whether treating these sleep problems will have any improvement on women's cardiovascular health. And that's a question that remains to be answered. There's several different effective treatments for sleep problems. Well, the first thing that women should do if they're having sleep problems is to get a good workup by a sleep center. So one of the main things to look out for that didn't explain associations here, but is a major sleep and cardiovascular factor is apnea. So apnea does go up during the menopause transition, and women should be evaluated for that. If there's no other causes for their sleep problems, traditional sleep interventions include very effective behavioral interventions, so cognitive behavioral therapy for insomnia. There's also brief behavioral therapy for insomnia, so CBTI and BBTI. Probably the first way to go. There's sleep medications women can use, a range of different effective sleep medications, which are good in the short term, but in the long term, you really want to go the behavioral route. And something to avoid is the use of a class of medications called benzodiazepines or benzos. Don't use Xanax or the like for sleep. Those are not sleep medications. Stick with the BBTI, CBTI, connect with the sleep center in your area. There's a lot of different questions that remain to be seen. So one is typically we think of what we see in the study of women's health across the nation, which is a large longitudinal cohort study of women transitioning through the menopause. There's evidence of accelerated accumulation of atherosclerosis associated with the menopause transition beyond aging alone. Okay, so this ovarian aging versus chronologic aging. So that we know we need to show it using a wider range of cardiovascular markers. But assuming that is the case, why? Why do women have increasing cardiovascular risk? We typically have thought this is all about hormones, just about loss of estrogen, but that's unlikely to be the case. In fact, we looked at the relationship between estradiol, so our main ovarian hormone, and cardiovascular disease risk in our current study using the state-of-the-art measures of estradiol, and this did not explain associations. So hormones are not the whole answer. What else is going on during the menopause transition? There's hot flashes, there's sleep problems, there's weight gain. So really understanding the contributions of these variety of menopausal experiences to the development of cardiovascular risk during the menopause transition, I think this is crucial. So with respect to sleep, I think that so many women are suffering from sleep problems. This is incredibly common. And I think there's this perception that this is just something that you have to gut out, stick it out, suffer through, and that it doesn't have implications for their physical health. It does have implications, and they really should seek treatment for their sleep problems. Don't just suffer. Seek some treatment. There are effective treatments out there, so that will improve their quality of life as well as potentially improve their physical health.